I always have to put down the microphone after Seamus because he's a small bit taller than me. You might have noticed that. Anyway, Seamus, thank you for your poetic words and always so interesting. You might give him another big round of applause. Seamus O'Rourke. As I often say to him, for a Leitrim lad, he's sound. He's grand. Isn't that right? Now, ladies and gentlemen, or gentlemen, I should say, so used to saying that. Our next speaker is from the Department of Health, and she's going to speak about Healthy Ireland's Men Talk. I know you're going to give her a big warm welcome and give her your full attention. From the Department of Health, will you please welcome Biddie O'Neill.
Can you imagine having my job to follow that? Thank you, Seamus. For me, it was a complete tour down memory lane because I grew up in a small farm in West Clare, something in common with you, Marty. And so I could relate to the dance, I could relate to the farm, I could relate to the men outside the church and the shop. So it was a real trip for me down memory lane, and wow, such poetic words. But I get the slot to talk to you about a more serious issue around health and why it's important and why men's health is important. So I've worked in health for over 30 years at this stage, and mainly in health promotion. I started out as a nurse, and then I went into the side of how can we support people to stay healthier? You know, how can we support young people on all through their life to become healthier and stay healthier. And at the outset, just to say, I've been involved in men's health since the very outset. I was working in the southeast region down in Kilkenny when we started doing some work around men's health. Women's health had been on the agenda, but men's health was slow to come on the agenda. And I suppose I'm here to say that it is very much on the agenda, and that, I love men. Men have been in my life always. I've had a father, I've had brothers, I have a husband. You know, men are a big part of my life. And I also saw back many years ago that women were much better at going forward. They were more engaged with the health system already because by their nature they might have had children or whatever. For men, there was that reluctance. I saw it in my own family, a reluctance to actually recognise there was something wrong, but then actually a reluctance and a fear of asking for help. So I'm just going to give you a little bit about what we do and why we're doing it, and I suppose why is there a focus on men's health. So just initially, just to say from a Department of Health, I currently work in the Department of Health in Healthy Ireland, and Healthy Ireland is a section within that. And our role really is to promote health and well-being. It's to support people to stay healthy. It's to build young people that have resilience and that have the supports they need around their health. So we have a very broad agenda, and there's a number of national policies that guide that work, and they've been developed over the last number of years. And then within the HSE itself, there's also health and well-being. So policy starts in government, policy starts in departments, and then it translates down into the operational side, and that's what the HSE do, they deliver. But it's really important that it's in the policy, because if it's not in the policy, it doesn't get the political attention, it doesn't get the political focus, and we strive to keep men's health on the policy. So some of our key priorities you'll see there. We continue to have real challenges around lifestyle issues like overweight, obesity, tobacco use and alcohol misuse for society, but also for individuals and also for families. And these are real challenging issues for people to address. Physical activity levels need to be increased for people to get the best and to stay healthy for as long as they can. Mental health promotion is an area that has come very much on our agenda, particularly post-COVID, because I think the whole impact of COVID on people brought the whole mental health piece very much to the forefront. And I know from talking to Enda and those involved in the association, a lot of men disconnected from the sheds, the time they needed it most. But it was a very isolating, lonely time for a lot of people. So mental health and well-being is a really important part. We work at community level, we work with healthy communities, we work with healthy cities. So we work with all different agencies and to promote health and to encourage people to get involved. We work across schools, workplaces, clubs, prisons and campuses. And the head of Healthy Ireland actually visited a men's shed in Mountjoy prison and was hugely impressed by how that initiative can support the most marginalised men in our society. And we also have a role around research and evaluation. So I suppose the question asked often is why men's health? So why do we need to focus on men's health? We still have a gap in life expectancy between men and women. Now it has improved, it has narrowed, but that gap is still there. Men die younger than women. So that is enough of a reason for us to really warrant more investment in this area. The lifestyle impact on men, and again in all the different areas of inactivity, alcohol use, tobacco use, there are higher rates in men across the population groups, and that's from our surveys. The leading causes of death for everybody in society are the cancer, heart disease and respiratory. They're higher for men, they're higher for our male population. And the risk of men dying from cancer is 34% higher for men than women. And this is because men do not seek help early. They delay going for help until things have escalated. So that early awareness, that understanding of what's going on is really critical for men if we're to improve that statistic. And then men are less likely to access the health service because, as I said, historically they didn't. There's the kind of the stoic macho kind of image for men that's what I grew up with all those 40, 50 years ago. Men were like tough and strong and they were able to deal with anything. So in Ireland then, over the last 24 years, we started, men's health was named on a national policy. And that was the first time it was named. There'd been a lot of work happening in women's health. And we did some research in 2004, 2005 and identified the needs of men. And then Ireland was the first country in the world to develop a national policy on men's health. So we were quite progressive to name this and to get support for it at national level. Unfortunately, when the policy was launched in 2009, we hit a recession. And when you hit a recession, everything that's not essential is cut. So the work that we're involved in, like supporting people to get healthier and all that, is not seen as essential because it's the hospitals, it's the beds, it's all of that. So we took a big hit in those years. But in 2013, Healthy Ireland was established in the department with a goal to get everybody working together around improving health and put it on the agenda. And then the HSE launched their Men's Health Action Plan in 2017. So men's health has stayed on the agenda and there is very much a policy context. So since I was involved in men's health initially, what has changed? I think there's a much greater focus on it. I think it is very much on the agenda. There's some really good partnership working going on. Like we are very involved with a number of voluntary organisations. We've big engagement with the Men's Shed Association, but we work with a lot of voluntary organisations with other organisations like the Cancer Society, the Heart Foundation. There's a lot more of those organisations have brought a focus in on men's health. There's been a huge amount of programme development. Like there's been some really interesting programmes around Engage, which I'll talk a little bit more in a second. There's been a huge development in terms of programme Men on the Move, which is a physical activity programme for men. We've got Farmers of Heart, and more recently we've partnered with the Department of Agriculture around On Firm Ground. And On Firm Ground, what On Firm Ground is doing is training up advisors and vets to be able to engage with men in relation to their health and signpost them if they feel they need help or they need support. So that's a really progressive project, and the Department of Agriculture have really come on board with it. We have clear evidence of what works. So we know that addressing men's health is different to women. We need different approaches. We need to engage them differently. We need to go where they are. Like, it's great here today that they've put on the health checks for the men coming in and giving you that option, because you're here, as opposed to someone saying to you, will you go and get a health check? So going to where men are at, like the Farmers of Heart programs, they went into the marts to meet the men when they were in there. That's how you engage them. You go where they are, you make it, and then once a few people step up, others will follow. So it's the courage and the support to get going. So we do need different approaches, and we have developed different approaches. We have Men's Health Week every June, which is a really strong partnership, all-island initiative that really focuses on men, and that has grown and grown in recent years across many organisations, many workplaces. The amount of people that now sign up for Men's Health Week is phenomenal. And the Men's Health Forum leads out on that. And the Irish Men's Sheds Association has become a very significant national organisation since we launched our first policy on men's health. So just to give you a picture, Engage Training. So Engage Training was a specific training that was developed for health professionals to work with men. And again, it's that piece around what's the different approach that's required. And over the last 10 years, we have developed, there's been 8 units of Engaged Training developed, all dealing with different aspects. There's been one for young men, there's been one for men in the middle, because that's a vulnerable age group, and then we have On Firm Ground. It's evidence-based, it's research-based, and it is a very strong programme. So this is specifically for working with men and engaging men across the life course. We try to work across the life course, and what I mean by the life course is that there's, that we can ensure healthy lives and promote well-being at all stages in life. And we all go through a number of transitions from infancy to early childhood, up to teenage years and into adulthood, and then into older age. So it's about having, I suppose, interventions and support all the way along. So children in school will get exposed to health and well-being. We work with sports clubs, we work with the GA. Some of you might have come across the Healthy Club project. We've recently launched an initiative with the RFU and the FAI. So every place where there are groups of people, there's an opportunity to influence their health and well-being. So it's evolving. Our health evolves all the time over those different life stages. And just in reflecting then and thinking about today, like one of the key milestones along the way for older adults, and I'm aware that the membership spans a very wide age group, but I also know that the average age of the men in the men's sheds is between 65 and 69. So I suspect that it's quite a lot of men are at retirement age when they join the sheds, but obviously it is open to all the other age groups. And I suppose I was just looking at some of the research around the impact of retirement, and one of the things that has come up very strongly is men find it harder to adapt than women. That's strong statistics. And it's because of a number of reasons. So it's the risk of identity loss. Who am I without my job, without my role? Whether that's the farmer that Enda mentioned, handing over the farm to the nephew, 'cause that's been my life, that's everything I do, or if you've had an office job, or you've had whatever type of a role you've had, actually that moment of retiring is quite significant. There's a sense of belonging at work, even though we give out about it at times. There is a sense of belonging. There's a sense of purpose. I have a role every day that's really important. There's a structure to everyday life. I get up, I go to work, I come home, whatever. There's a structure. There's a loss of social connectedness with retirement, and there's changes in family roles. So if the woman has been at home, or if the man has been at home in the farm, when people retire, it upsets the whole thing. There's a different balance. So the impact of retirement can be quite profound. And then what was really interesting was to look at what were the findings in terms of Shed's contribution to well-being, because the Sheds for Life, some of you may have taken part in that programme. The evaluation of that showed that Sheds for Life contribution to well-being, or the Shed's contribution to well-being, participation is really important. Development of new skills, a sense of belonging is created again, supporting and being supported, and contributing to the community. So what struck me was that this was a really nice way to counteract the impact of retirement for many men, that this meets those needs along the way. And that's really valuable, and it's a real contribution to society as well, in terms of having that place that men can go. So Enda mentioned that yesterday, had I forgotten to press forward the last one, apologies, but it counteracts them. So yesterday was a significant day for us as well, in that the new Healthy Ireland Men's Plan was launched. And that's for the next 4 years. And that was, again, it's about keeping that on the priority list and making sure we focus on it. And there's a number of key principles that drive that, and it's about having, eliminating disparities. We know that there's between different groups of men, there's different vulnerabilities, there's disparities, so it's about trying to create gender equity. Empowering men to take ownership of their health. I grew up in a house where it was probably the women told the men to go to the doctor or encouraged them, So I grew up with this, and I still struggle a bit with it in my own life, that I'm nearly responsible for the men's health. So it was inbred into us or ingrained into us, certainly in rural Ireland. So it's supporting men to take responsibility for their own health. Promoting health across, at all the different stages, and ensuring that we take account of men and their needs. Intersectionality, I suppose, looking at how the health outcomes can be influenced by social system, from the privileged to the marginalised. And we know for the marginalised, the health outcomes are poor across all different aspects. There's collaboration and partnerships underpin it, which is a very strong sense of how men's health has evolved in Ireland anyway. Community development approach, and men's sheds are the heart of the community in lots of ways. Evidence-based and leadership. So this is kind of, I suppose, the guiding principles for the next phase of Healthy Ireland Men. In relation to the men's sheds, there is a specific action in there. So men's sheds align very much with the implementation of the overall plan. Men's sheds are core to that. And it specifically states to support the Irish Men's Sheds Association to provide a national support network for men's sheds and support the implementation of Sheds for Life. So it's very clearly one of our priority actions. So it is a huge opportunity, I think, for the Irish Men's Sheds Association. You have a key role in delivering on the overall plan, and we work with Enda and some of his team on that. And as I said, sheds are community development in action. I had the privilege of visiting a few sheds, and I just came away just completely and utterly enamoured by what was going on and the space that's created there for men. So finally, just a couple of challenges as I see them. So improving, people are living longer, which is a really good thing, but what's really important is that we live a healthier old age. Healthy life expectancy is really important in the context of the ageing population. And somebody said yesterday at the launch of the Men's Health Plan that by 2040 we will have there will be another 20% or some staggering figure increase in the number of people over 80, 50% increase or something in people over 80. So that's a staggering figure. But what's really important in that is that they're healthy and well, and how we can support people to stay well. Targeting interventions at communities where they're most at risk, that's really important. How do we engage marginalised men? And like I mentioned there, that men's shed in the prison setting is so innovative and may have such a positive impact in terms of those men who are most marginalised in society. How can we support men to connect with their vulnerabilities? Because we all have vulnerabilities, male and female, and how can we get men to connect in with those and trust that it's okay to be vulnerable and need support? How can we get men to normalise the conversation about how they feel? We're bottled up emotions, and to give the statistic there about suicide, we need to really work against that. And frequently it is bottled up emotions, pain, trauma, hurt, that becomes so overpowering that feel the only option they have. So we really have to work with creating that space that it's okay to talk about how I feel and who I am. Our feelings are our own. Nobody can judge them. They belong to me. This is how I feel. So it's about normalising that for men, I think, and creating that space. And how do we get men to value their health? Because it's our single most important asset. you know, and when you meet people and they're getting older, they will all say, yeah, my health is actually my most valuable asset. So it's been a real privilege to be here. I get I get a bit excited about this kind of an event because I just feel the energy in the room, and I see what the Men's Sheds Association is doing. And, you know, we will continue to support it from a national level. We will continue to work with the national organisation. We continue to support Sheds for Life, and we see it as a real core part of the work we do in Healthy Ireland. So thank you very much.
Thank you very much, Biddie O'Neill, for that incisive and interesting insight into what is very important to all of us as men's health. Where in West Clare are you from? It's a secret. Anyway, good to have another fellow West Clare person here beside me. We're going to have a panel discussion now.